Hi, my name is Dr. Diane Kulik, and I'm a family physician at ABC Wellness. We have our office in Sterling Heights, Michigan. And I just wanted to tell you about a new cancer screening test that we're very excited about. I did the cancer screening test myself, and I was very low, and so I thought a lot of patients might really want to find out for themselves what their risk level was. It's a company called FirstMark ONC, and they have a blood test that measures a tumor degradation product that you can find in the blood with a whole host of different cancers. Now, international studies have linked elevated levels of this marker, TDDFP, to many different kinds of cancers. The company also includes free with it a PSA for men and a CA15-3 for women, which is specific for breast cancer. Now, the test has been shown to be elevated in many different tumors. Some of them include cervical, colon, lung, ovarian cancer, rectal cancer, stomach cancer, bladder, brain, esophageal, leukemia cancers, liver, lymphoma, pancreatic, skin, thyroid, and kidney. So a whole host of different cancers throughout the body can be screened for with this one marker. Now, this test is unique in measuring this cancer-related marker, but what other things could also cause it to be elevated? So high levels of this TFFDP, this cancer marker, can be caused by other things that affect cellular dysregulation besides cancer. So it may happen if you have a blood clot or a pulmonary embolus, or if you have major trauma to the tissues, if you're pregnant and you have preeclampsia, or even a severe illness or infection. But usually those things you could rule out just by examining the patient or their history. So the marker is not absolutely definitive, but usually it's easy to check what other conditions might cause it and still give you a pretty good idea if the patient is elevated due to a possible cancer or some other reason. Now, some of the other diseases that could be related to this marker would be things like smoking. Even if you don't have lung cancer, smokers could have it elevated. Also, we talked about acute infections, say pneumonia, maybe an autoimmune disease, say like rheumatoid arthritis or lupus. Again, those should be easy to determine, or a major trauma. So the presence or absence of cancer is not 100%, but you can check those other conditions, which are medical diseases that the doctor or the patient would probably know about. Now, there are specific instructions on how to test the blood. Once you draw it, the lab that draws it needs to know that it has to be properly clotted serum and not plasma, because the serum from incompletely clotted blood may already have fibrinogen. So you don't want to have a conflict with that, with what the test is measuring. So it's very important to do accurate blood draw and test the clotted serum to get an accurate result. Now, since this isn't a regular lab test that you could get done from your hospital or regular office, you're probably wondering what it costs. And the company only charges $189 for the full fibrin degradation products test, plus the other two that they throw in, which is specific for men or women, either checking for prostate cancer or breast cancer. And they send you a full written report of the result and where you fall on the scale as far as low, medium, or high risk for cancer. So it's a lot of information that you get for the price of the test. Now, you're probably wondering, has this been really validated? And yes, it has. 6,500 patients at least have had this first ONC test done and validated to show how accurate it is for detecting early cancer or showing that you have low risk. So it really was designed for patients and their physicians who want to be able to have a test that'll check a good screening test for all those different kinds of cancers and show that you have low risk, and it's definitely been proven and documented. So what if you get a negative or very low test result? I feel that's very reassuring. Of course, nothing can tell you 100% that you don't have cancer if you're having any significant symptoms, pain, problems in specific areas. You may still want to have some other tests, say a colonoscopy or a mammogram, to evaluate those. But your risk is going to be very low when you get a negative result. Now, one of the great things about this test is the confidentiality. Obviously, since it's not going through your traditional insurance or lab, the results only go back to you and the doctor that ordered it. It's not going to your insurance company. It's not going to affect any insurance. It doesn't go to your employer. You get the results. You get to deal with what to do as far as follow-up. So I think that's the real benefit of the way they set this test up, is that it's purely your information. Now, what if your test shows moderately or severely elevated? What do you do next? Fortunately, the company has very written protocols describing what to do and in what order to evaluate the possibility of cancers, what things can be screened, how to follow up, and it gives you and your doctor a great idea of what needs to be done next when there's any question. And certainly also helps you list what are the possible interfering or false positive things like the autoimmune disease, pregnancy, blood clot, major infection, etc., that may cause problems. So it really tells you what to do if your test shows somewhat elevated. So in conclusion, we have this fabulous test available at ABC Wellness that measures fibrin degradation products, protein that's seen in cancer cells, multitude of cancers, can also be seen in other conditions and diseases, which usually we can rule out by history or exam. The company gives you a full written report stating your risk, and definitely whether you're low, medium, or high, there are so many things that we use here at ABC Wellness that will help support your immune system for prevention to keep you healthy, or even in the cases where people do have cancer, to help your body fight the cancer and help support your immune systems, keeping it very strong. So if you're interested in finding out and getting more information, please call us. I'm Dr. Kulik at ABC Wellness, and our phone number is toll-free 855-NOW-WELL. Thanks.